Good day, everyone. Michelle Needens here, social worker with the Cognitive Care Network here at the ADC. And we're really going to talk today about the value of telling others and that whole process when your loved one has been diagnosed with a cognitive decline or a dementia. Sometimes there is some hesitancy, and I would say oftentimes there's hesitancy about telling others when there's a new diagnosis. That hesitancy comes with a heaviness that really falls on the shoulders of both. And I think for you as the care partner, often it's about trying to take the lead from the person diagnosed. Do they want others to know? Are they ready to share? Sometimes they even say to you, do not tell anyone. Don't talk about this. And so how do you sort through all that? Well, I want to understand more about the hesitancy. Sometimes the person doesn't want anyone to know for a set of reasons. For example, perhaps they're still in the work world and they're concerned about some sort of consequences related to that. Actually, we are going to have a mindful minutes just dedicated to managing concerns with memory and cognitive changes in the workplace at a later date. So a lot more on that in a subsequent mindful minutes. Sometimes they're afraid, even within their friend base or their social base, their acquaintance base, that they're going to be seen differently from others. Maybe they're even concerned about how family would see them in some way. Maybe they're concerned about adding some burden to adult children, etc. So there's all these fears around what's going to be the reaction, what's going to be the sequel to our relationship in some way. So there's these fears, and that sometimes stops people from willingness to talk about it. Sometimes it's just them getting used to the diagnosis. There's some shock associated with getting this diagnosis. Even if you suspected it, even if you saw these changes coming, hearing the words and having it validated still is a shock to some degree. It is still something that our system has to acclimate to and adjust to and to come to some kind of terms with. Acceptance comes over the course of time. But even as acceptance is in process, so to speak, there still needs to be, getting over this, just this assault to the system in hearing and having that diagnosis confirmed. And I also think it takes some time to think about, learn about the disease, sort through our reactions and adjustments in a way that allows us to talk about it without getting overwhelmed. Sometimes they're hesitant to share with others because they disagree with the diagnosis. Maybe you do too. And that's normal in these early stages. And of course, if there's a concern, there's always second opinions to be secured. And in that process, you might not want to be in a position to tell people when you're not sure and you're having second opinions or you're having a PET scan to validate or those kind of things. You may want to be on more sure ground in terms of your own assessment of accuracy of diagnosis. So then what is the value of telling others? Why in the world are we telling other people? Why do we encourage the person living with the disease to tell? Why do we encourage you to talk about it? Well, it reduces performance anxiety. And I would say that on both fronts. For the person living with the disease, there's a lack of confidence that goes along with that. And as that confidence diminishes, they get concerned about often in social situations, am I going to misspeak? Am I going to lose my train of thought? Am I going to lose a word? Is somebody going to look at me? Is it going to make sense in some way? That there's this lack of confidence. So even when they speak well, nobody would notice. They know that comparison, and there's anxiousness that goes along with it. Perhaps it's that you're in a bridge club and play bridge with a set of people, or a foursome in golf that it's a set of acquaintances, not close friends. And so there can be these performance anxiety moments that make everything worse. In fact, it feeds depression. And so by telling others, it reduces the chance of that performance anxiety. And for you too, because you are positioned to cover. And when your loved one is saying, don't tell anybody, I don't want people to know. I mean, you're working hard at trying to make sure, you know, that exposure doesn't happen. And so there's a bit of anxiety on your part as well. And maybe more than a bit. It expands helpful responses to both of you. People need to understand what's going on. Often they know something's going on. And maybe they conjure up some reason in their head that may or may not be accurate. Maybe they know, gosh, I see some of the cognitive decline, but they're not going to bring it up. Most people don't bring it up. Or maybe they think depressed, maybe they think you're mad at them, who knows what they think. But it expands their ability to be supportive and helpful in the way that's useful to you, not into that pitiful, oh, I'm so sorry look, but really what would be helpful responses. And the only way to get there is for you to be in open dialogue with them, to be having these honest conversations. Here's what's going on. And there's oftentimes potentially common experiences. So sometimes when you share that diagnosis, people will say, yeah, you know, I was diagnosed with that. Or for you, even more common, people saying, yeah, I went through that with my mom. Or, you know, my husband's going through this. Or, you know, I had an aunt that did this, or my best friend. So you get these common experiences that can be helpful. And then, you know, you serve to advocate for others, that it puts you in a stronger position to help your loved one that has been diagnosed with a cognitive change, that you're in a stronger position to be his advocate or her advocate, or to advocate for good responses from friends. Perhaps someone says, yeah, I see some changes in mom, but I don't think it's Alzheimer's. And perhaps you can say, you need to have it checked out. That is kind of how it starts, or whatever. So you're just in a stronger position to advocate. So then the question is, who do you tell? If the person living with the disease says, absolutely not, you're not to tell anyone, they really can't control who you tell about your own experience. And that may shape who you tell, but there's still people to tell. You need support too. And you need to be building your support team too. So that has to be a fair dialogue. So maybe it's you telling your best friend, you know, rather than his friends, etc. So toe in the water principle, I would say, hopefully, let me say that you're able to have a dialogue either with yourself or with a objective outside person like one of our team, or the doctor or whoever, that helps your loved one see that telling a few people is important. So I've known of individuals who, once they're diagnosed, they begin telling the world. And that's okay, perfectly okay. That's some people's style. Most people's style is toe in the water. In other words, you just start by telling a few people that you consider closest or most important for some reason, and you see how that goes. I will tell you that in 99.9% of cases where I have had a person hesitant to share their diagnosis, they begin to share it, care partner begins to share it, and there's just a weight lifted off the shoulder. That just is such a common experience. And so who do we begin with? Maybe those who were most likely to have recognized the changes. So the bridge group or the church group or the adult children, whoever would be most likely to have started to recognize some of those changes. Maybe you start with or add people that are part of environments and where anxiety has gone up because of those situations. Maybe church, maybe your loved one is the facilitator for a circle meeting, or the one that keeps, that is always asked to say the prayer, or maybe your loved one is has a leadership role on a board of directors for a not-for-profit or in the neighborhood. Or so really thinking through what are those anxiety provoking situations and how can we share with some of those key people to reduce the anxiety. So there's not that performance based, there's not that anxiety people know, understand, or supportive outcome. Those that can help you stay connected or your loved ones stay connected. So very important that isolation not occur. The more the two of you shrink, the person with the disease as well as yourself shrink from your social lives, from the people that really have been a support, that give you energy, that allows respite of the mind, so you're not focusing all day, all the time on this new diagnosis or this diagnosis, the more depression occurs and the worse you'll both do. So you got to stay connected to the world. You got to be out there doing things. And to do that, the people that are part of that world need to have some understanding. And certainly those that can be emotional support for you, that you can just share and be open about, and that you can get some support from. So you think through consciously who you tell, and that network of the knowing expands. What exactly do you say? I mean, how do you say this? Is it important to share the diagnosis? Yes, in some cases, not necessary in other cases. If you have a loved one diagnosed with mild cognitive impairment, early Alzheimer's, early Lewy body, early vascular dementia, early FTD, all of those carry some different sorts of symptoms and variables. And so it may be important to share the diagnosis just if there are specific symptoms that somebody needs to kind of keep a look at it, or just understand. Never is a good idea to just say, well, my loved one was diagnosed with mild cognitive impairment, because people do not understand that alone. They have no idea what that means. It gives them no context, and it doesn't allow them to know how to help you or how to help the person diagnosed. So that conversation has to be a lot fuller than that. They really need to understand how the diagnosis is affecting the person diagnosed as well as you. So what it means is, he's having some short-term memory problems. So he may not, remember the appointment or the date. He's keeping several calendars. We're trying to consolidate, but there, some things get lost. And so what's helpful is that you email me too. If you make a plan with him, email me too. So you're not only showing how does it affect the person, but you're also asking them to join you in how to handle that situation to make it better. So again, it's overcoming some of the barriers, some of the blips that we really have control over and can make easier. So teaching them what would be helpful. If somebody misses a word, to say, just add it in. Or when you, see him, say, integrate people's names in the conversation so that person, hears the name and it comes back to them or whatever. So you're sharing the diagnosis, you're sharing how it affects, you're sharing what would be helpful, and you're also sharing how you're handling it. I'm doing okay. I'm adjusting to the diagnosis. It was a surprise for us. And, it's going to be a bit. And so I just appreciate your, thoughts and good wishes or whatever. So how you're handling it and what would be helpful. And then the affirmation of continuing strengths. So these diagnoses does not mean that there's not capacity still there. There's not resilience still there. There's not capacity to do certain things, skill-based. So to say, Harold's adapting, he still has a sense of humor. He's still loving to play golf. He's still, out there walking the neighborhood or whatever it is. So this affirmation that the person living with the diagnosis still has a lot of ability. And then to think about what form to take it in. I've seen people do it several ways. I've seen a joint letter from the care partner and person diagnosed sent to their family and friends. I've seen it sent in a holiday letter. Those individuals who write it through email or through letters will say it gives the other people a chance to really think through their reactions before they react. They might have some shock to you. There are others that say this should be an in-person conversation. So to invite, a couple of friends over, for a glass of wine out on the patio and to share the diagnosis then. So however fits for you. It absolutely can be in writing if you want to get the words in a way that you feel comfortable, and it absolutely can be in those informal conversations. If the person isn't ready to talk about it, if you're not ready to talk about it, I want to understand why. If it's because it's a new diagnosis and I need to sort through it, that's fair. If it's because I'm so depressed, we need to be working on that depression. If it's because of shame, we need to be talking about that. Would you be ashamed if your loved one was diagnosed with a new onset of diabetes? Would you be ashamed if they had had a stroke? So sometimes the hesitancy in talking about it, the not ready to talk about it, means you need some additional support or processing. And I encourage you to reach out and talk about it. Sometimes you just need to process a set of things before you feel prepared to share. And the same with the person living with the disease. Everyone has their own timetable. I will say it's better earlier than later. I think you and the person living with the disease need to remain in the driver's seat as much as possible. So allowing people to just speculate what's going on, or even if they have it right, maybe they don't understand the diagnosis and maybe they hold on to some stigmas about the diagnosis. Let's not go there. You take the driver's seat in sharing the diagnosis, what it means. So do that earlier rather than later. But again, understanding that we have different timetables. Again, often people have an idea. So it rarely is brand new, shocking. It just often is an explanation and an understanding. So again, what are the value of telling others? In summary, it reduces the risk of isolation. The more people are in that protective stance, the more people are at a point where they don't want to expose those deficits, the more isolated they become. And the more isolated, the more depression. And depression makes everything worse. So it reduces those risks. It reduces the risk of that performance anxiety we talked about, that you just can take a breath of, yeah, these other folks are going to be patient with him and know to fill in the word if he can't find it. Maybe the other people are not going to put him on the spot. Or maybe they'd be willing to pick him up and drive him to his men's group. So it just, it expands your support team and it reduces the risk of that protective spirit that you as care partner, most care partners develop, especially early on. You use your struggle for the greater good. That's the strongest coping strategy known to man. So maybe by sharing, someone else can have these honest conversations with you. Maybe you can share honestly and be a support to others. Maybe by, joining a support group, you have something worthwhile to share with someone earlier on in the journey. As always, if you have questions, thoughts, if you need to process individually about anything said in the Mindful Minutes, know we're here, and we're certainly willing to have those conversations with you. You take good care, keep connected.